I'm also part of the 999 of the NHS campaign, and I run a Safe Staffing campaign called 4 to 1. We're campaigning for mandatory minimum staffing ratios in the NHS, and I just wanted to talk about staffing because this is a crucial thing. I mean, nursing is in a state of crisis across the NHS. The RCN did a survey of, they did a survey with the Daily Mirror last year and found 60% of nurses were considering leaving the profession. The RCN London did a survey across London trusts and found on average 17% of Band 5 nursing posts are vacant across London hospitals. 17%, and it's similar for the Band 6, 7s and 8s, and this is causing, and this is exacerbating the already chronic problem we have of understaffing. Nurses are getting burnt out, they're leaving. New nurses who go in only stay in for a couple of years and then leave because it's just too much. I mean, our campaign 4 to 1, we get people emailing in saying, I'm looking after 12 patients on a day shift, 16 patients on a night shift. I mean, you're talking about staffing levels where you've got 3 or 4 minutes per patient per hour. You cannot give good care in this time, and then when you don't give good care, you get pulled up by management for not prioritising properly, and there's horrible bullying atmosphere in the NHS. And despite the Francis report, despite everything, it hasn't changed. There was a survey by Nursing Times last year. 76% of nurses said there was no change or conditions had gotten worse since the Francis report, and this has to be resolved. But there's something happening which is potentially going to make it even worse. The Department of Health has said that they want to cut unsocial hours payments for NHS staff now. This is part of the drive to bring in 7-day working in the NHS. Their justification is, and there is a real need for this, they need more specialist staff at weekends because the hospitals are understaffed then, and death rates are higher. But they're using that reason to attack our pay and say that we should pay for it by pay for the extra staff, by giving up our own social hours instead of investing in the NHS, because they don't want to give any more money to it. And so my hospital branch, Unite, guys in St Thomas's, has called a demonstration against this on the 30th of April. We're going to meet outside St Thomas Hospital and march with the Department of Health. I'd really like the Convention to back the school to publicise it. Everyone's welcome to come down, but we're primarily trying to organise health workers, because we need to be at the forefront of this, fighting to defend the NHS. And it's crucial. We have the power to stop this, because actually, if they do bring this pay cut, it's going to make it even worse. Nurses will leave in droves, or they'll go and work for agencies. And I mean, and it's a real issue now. I mean, anecdotally, we're struggling to staff our hospitals now, right now. I mean, last week there was a day we had 45 vacant post shifts across the hospital. Like one day, yesterday was 15. And I mean, just to give you an idea, like after tax, I take home about £120 for a 12-hour shift. As one of my colleagues said, that means we're saving lives for £10 an hour. And if you work for an agency, the same shift, you're going to get £330. Now, of course, nurses living in London, in the capital, with the cost of living going up, they're going to look elsewhere because they need money to supplement, to pay for their rent, to pay for their kids and things. And this is what's driving people out. But we have to stop it. We have to fight back. We have to stop this attack on our pay. We have to fight for mandatory minimum staffing to improve the conditions so nurses come back to the NHS. So they actually work in Australia. The nursing unions had a really successful campaign to 1 mandatory minimums. And part of the deal is they banned agencies. They said, if you work for the NHS, you join the staff ranks. I will never work for an agency on principle, but we need to make that case. There has to be a movement and a fight to do that. So please come down, publicise the action on the 30th. Come down and get involved, and please support us. Thank you.